Ultrasound-guided, minimally invasive synovial biopsy is an emerging technique among rheumatologists which has the potential to improve diagnosis and measure the therapeutic response in patients with inflammatory arthritis. High-quality synovial tissue will facilitate further understanding of the mechanisms involved in the inflammatory joint process and aid biomarker discovery programs for both diagnosis and therapeutic response. This educational video has been made with the support of EULAR and the members of the Synovial Biopsy Task Force. Here is the package containing a typical single-use sterile guillotine-type disposable core biopsy instrument and accessories necessary for the biopsy procedure on a single joint. The package contains the instrument, which is composed of a body that contains the energizing or loading mechanism that can be energized to a desired depth of 10 or 20 millimeters as shown on the penetration depth indicator, a plunger which is used to 1. Energize or cock the instrument, 2. Advance the sample notch, and 3. Fire or discharge the cutting cannula. And finally, the needle itself, which consists of a centimeter calibrated outer cutting portion and inner stylet containing the sample notch. Note that the outer needle and inner stylet are ultrasound enhanced. Also contained in the package is a disposable coaxial biopsy trocar with inner stylet and a 10 millimeter adapter which permit the collection of multiple biopsy specimens via a single puncture of the joint. In order to properly perform a biopsy, the following materials will also be required: antiseptic agent and appropriate dressing, appropriate specimen container, sterile surgical drape, sterile gloves, sterile gel or other transmission agent such as alcohol, sterile scalpel blade, sterile gauze pads, sterile injection needle and syringe with the size depending on the joint being biopsied, an ultrasound machine and appropriate probe with the settings adjusted for the specific joint, probe cover with non-sterile gel. The synovial biopsy of the knee is performed in the suprapatellar region, as indicated on the model. The anatomic image is a long axis cut revealing the suprapatellar pouch in this area, and the final specimen is that of a skeleton showing the positioning of the needle to enter the suprapatellar pouch. Obviously, if this were a patient, the biopsy would be performed under sterile conditions. We will simulate the introduction of adequate local anesthesia under ultrasound guidance at the entry site and into the suprapatellar recess or pouch. This will be followed by a small incision of the skin made with a scalpel blade. After removing the instrument from its package, we have elected to initially insert the disposable coaxial biopsy trocar into this large joint. This allows for multiple sample collection. When the trocar is utilized, it is essential to attach the included adapter to the trocar before proceeding to maintain the appropriate depth of penetration of the cannula and needle. Grasping the body, energize or cock the instrument to the desired depth by pulling back on the plunger to withdraw the cannula together with the inner stylet until they are locked in place. Checking that the inner stylet of the instrument is fully retracted so that the sample notch is covered by the cannula, insert the instrument under ultrasound guidance through the trocar. Be sure that the bevel of the needle is pointing upwards into the joint, ideally where the synovial hypertrophy is most prominent. Gently push the plunger to advance the inner stylet containing the sample notch into the joint until it is fully deployed, and assure that the sample notch is directed upward towards the overlying synovial tissue. With needle visualization inside the joint, press the overlying skin surface with the probe to push synovial tissue into the sample notch. Now, fire the cutting cannula by pressing the plunger to capture the biopsy specimen in the sample notch. Maintaining the coaxial trocar within the joint, remove the instrument from the joint. Now pull back on the plunger until it is energized. Gently advance the plunger forward sufficiently to expose the sample notch containing the biopsy specimen. Be careful, as further pressure may accidentally fire the instrument. The synovial samples are carefully removed from the sample notch of the needle with a 20-gauge needle. Be careful not to alter the architecture of the tissue. Then, the various samples are processed according to the studies to be performed.